Our ultimate goal in access to care is to overcome any barrier and get clients into our care quicker and more efficiently. We utilize an open access model, which means anybody could show up any day or time, get assessed, and then ultimately feed whatever program that they need to step into. That could be psychiatry services, that could be general outpatient or intensive community-based services. Our ultimate goal is that individuals get into care quicker and that service starts as soon as they need it and when they're ready. Receiving the Access to Care grant really afforded us the opportunity to add more staff, and in adding more staff we've been able to serve the humans quicker, which was ultimately our goal, but also to provide a little bit more of an array of services. Our medical services used to operate really just off a nurse and a couple of doctors, but we know this community needed more than that. And through the Winnebago County Community Mental Health Board, this Access to Care grant has allowed us to staff that space and meet more clients where they're at. As a part of Access to Care, we expanded our hours, and so we provide services outside of what we might consider traditional hours. Beyond that, Monday through Friday, 8:30 to 5. We have hours that go into the evening. Some of our programs work weekends, and the ultimate goal is that we are then able to serve the humans because we know that life happens beyond Monday through Friday, 8:30 to 5. And so as a part of this and giving greater access to care to our individuals in this community, we are stepping into those hours where we know that they may need us most.
The Winnebago County Community Mental Health Board has allowed my staff and myself to be able to offer the medications free of charge with the vouchers. We are able to do our day-to-day operations, giving the long-acting injections. We're able to spend more time with clients because we have more staff. We are able to also get out in the community and be able to see them in their environment and things we could pick up on. They have done a lot to let us be able to grow, expand, and improve our overall care.
My position is extremely unique, and it's really important, especially for a job in the mental health service industry, because having that mental health practitioner to assist someone along the way, especially for someone who is apprehensive towards mental health services, is really crucial. I know for certain that a lot of people began services with my assistance. Also, in general, I know I've made a difference in a lot of people's lives who haven't even necessarily began services at Rosecrance. Referrals that I've spoken to were left in the dark about a lot of resources in northern Illinois that they had no idea that they had access to. And that's been a real passion of mine since becoming an access case manager. There's a real need for resource advocacy, especially in the mental health service industry and just the healthcare industry in general. And I really see that through these referrals and for people in marginalized communities and people who are in these communities. Their lives have been changed because they ask for resources for various reasons, and knowing that I have helped them find a resolution they're very thankful, and I know I've helped them.
When a client starts in a mental health crisis and show up at Mulberry, which they can just walk right in off the street, we do a triage assessment, then we do a larger crisis assessment. They will stay at the Mulberry location for up to 14 days. And in that time, we're educating them. We're getting them on the correct medications they need to be on to stabilize them. By the time they're ready to be discharged, we get them hooked up with the Ware Center and a psychiatrist so that care continues. We also make sure they stay on their medications, that they're able to get their medications, that they can pay for their medications or not pay, so we can help them. So it's very rewarding to see a client start in a mental health crisis and then end doing well in society and working towards their goals. We had a client that was not able to get to the Ware Center for a psychiatric evaluation. They needed to be treated because there was a KSI home, there was arrests. So we all worked together. We were able to get the injection to this client, give it to them inside their house. I talked with the psychiatrist. They agreed to do evaluation over the phone, which we never have done. They are doing very well. They are coming, they're engaged in services, and things are much better in their life, their family's life, the community, their community's life. So it was a very big win. There was multiple people involved, multiple staff were involved. So it was awesome.
We had an individual who came through our other program, System of Care, at the Rosecrance Harrison campus, started in withdrawal management, really trying to get their feet on the ground and become substance use free. Once they moved out of that program, they stepped into our Ware Center care and were able to continue in our mental health and substance use programming, as well as get connected to psychiatry to really stabilize out. They since then have been super successful and will be graduating from our program in the very near future. It's been a really great win for them, and they have really identified that having that consistent support and communication has helped them be successful.
You hear their story and you know that they genuinely need the services and they need the help. One client comes to mind for me. They were a single working parent, had minimal supports, working 2 jobs, and they were very, very eager to be in services. And they had substantial mental health struggles. With the stringent schedule that they had, I could only unfortunately speak with them during the evenings. Unfortunately, because of the financial struggles, they also often got their phone shut off. So it was a few months of just going back and forth. And one day, it was the evening on a Wednesday, it was like 6:30, and I decided to give them a call even though I haven't heard from them in a few weeks, and they answered. And they were very, very thankful that I called, and I asked if they were still interested in services, and they said yes, absolutely. And they asked, I was like, actually now is an okay time to have that assessment? And I said, yeah, I'm literally here all night, let's do it. So I completed that assessment for them and got them connected to services, and they're still engaged in services to this day. Knowing how services can help someone, I can't give up on those people.